Hello and welcome. Thank you all for attending. My name is Dr. Robin Terranella, and today I'm going to be talking to you about the role of vitamins in our health. And hopefully, this will help educate you on which vitamins you should be thinking about taking and why. The purpose of this talk is to just broaden your understanding of why we need vitamins to begin with and which ones you should really be thinking about taking, but also just give you a broader understanding of what vitamins do in our bodies in general. So the title of the topic is basically gets to that point, confused about which vitamins to take. There is a lot of confusion and misinformation, I believe, across the internet, as always. And so hopefully this will just help give you a better understanding of what you should be thinking about before you actually go ahead and take a vitamin, and questions you should be asking yourself before you do, or if you already are, maybe just improve on what you're doing in your health, and then also give you some ammunition to ask your doctor during those times when you are getting blood work done and things like that. So, okay. So more specifically, so the goal here is to empower you and do all that. More specifically, whoops. Let's see. Here we go. We want to talk about why we need vitamins to begin with. Why do we need to supplement with them? Who should really be thinking about taking extra vitamins among all those reasons? Who is more specifically going to be susceptible? What do they do on our body once we do take them, and where does this occur? Where do they work in our body? And then if we do decide we need certain vitamins, where are we going to get them? What's the best route of administration? So, and then, oops. So here we go. So do we really need to supplement to begin with? Aren't they in our food? So what's going on there? So first thing that comes to mind when I ask myself this is, and a lot of people see this too, is the RDA, the Recommended Daily Allowance. You'll see on the back of your vitamins, each one of the on a multivitamin or whatever you're taking, each vitamin there will have a percentage of the RDA, Recommended Daily Allowance. The RDA is basically something that was set up by the FDA to prevent serious illness from lack of vitamins. It's not really to set an upper limit. So some examples of this would be like scurvy with too little vitamin C, or beriberi with too little thiamine. So each vitamin basically has its associated condition or disease when there's not enough of it. But this is just a benchmark for the bottom. It doesn't tell us what the upper limit needs to be for these vitamins. And in some instances, it needs to be a lot more. Usually, most instances, we'll put it that way. But it also does not take into consideration the unique physiological needs of each person based on what their health is, digestion, genetics, things like that. And then in some cases, we have something called conditionally essential. Now, this is typically referred to with amino acids. Certain amino acids need to be consumed in the diet. Other ones can be manufactured by our body. And then there's another set called conditionally essential, where our body needs these during certain stressors or disease conditions. These are amino acids like arginine and L-tyrosine. There's a few others. But there are other scenarios, health scenarios, where we may need more of certain vitamins as well. And you can think of vitamin C is not something that our bodies naturally make at all. But during upper respiratory tract infections or other infections, it's helpful to supply a little extra vitamin C to help your body get over that illness a little bit quicker. And so this is important to note, because there are a lot of vitamins that could improve our health, improve how quickly we get over injury and illness if we take note of those vitamins. And so in summary, this section, the RDA is basically not an upper limit. It doesn't take into consideration your unique needs, but it does give us some benchmarks for, at least we're getting enough there. Um, so here is the slide for that, which we kind of skipped over. So now we're going to talk a little bit about quality and quantity food. Another reason why we might think about getting extra vitamins is that the quality of food and the consumption of food is not always up to par. So the CDC did a study in 2009 and surveyed a bunch of people. I don't have the exact number there, but they found that 70% of people are not getting enough, and they defined enough as 3 servings of fruits and 3 servings of vegetables. And 70% of the people were not getting that much. And 30% were getting that much or more. And so if the RDA is set to give us sufficient amount of vitamins, and those vitamins are coming from our food, but we're not eating the best quality food, we might not be getting enough to begin with to even get to that, very bottom of the barrel limit, which is the RDA. But another thing to think about too with your food quality is that over the last 50 to 100 years, the farming practices that are being used are not giving the best outcome for the fruits and vegetables in terms of their nutrient density. And you see this with several vitamins, notably would be things like selenium and magnesium. In certain areas of the country, the soil is going to be more deplete of these than others, but basically it's from improper farming practices, not rotating crops, not giving the crops enough, or the soil enough time to replenish itself, and you just pump them up with fertilizers to get them to grow, but the density of nutrients is not there. So that's an issue. And then you also look at, most of us consume alcohol, caffeine. It's not uncommon to consume caffeine every day. Alcohol maybe a little less, but if you are consuming these, each time you do, you're depleting your vitamin stores, and some more than others, but particularly with alcohol, it's going to be your B vitamins, thiamine, some of the other B vitamins, and magnesium, and caffeine is going to be your B vitamins. So those are important. So if you're not getting the quality of food or quantity of fruits and vegetables, you might want to rethink that. And also thinking about organic would probably be a good idea. But let's say you are. Let's say you have a perfect diet, no alcohol, caffeine. What then? You still need to worry about vitamins. Next thing that comes up here would be absorption. So are you absorbing the vitamins through your digestive tract? And turns out that if you have any of these health conditions here, disease, actual digestive system problems like GERD, IBS, Crohn's, ulcerative colitis, things like that, you're probably not. And that's because of the inflammation that occurs with these conditions. And even if you have more symptoms but no official disease condition like indigestion, gas, bloating, diarrhea, etc., you're probably not getting the best absorption either. The reason is, if you look at this picture here, basically what it shows is a cross-section of the small intestine, and here you'll see along the edge of those finger-like projections, there's a border there. It's called the brush border, and this is where a lot of the absorption actually takes place. And so on there, those are microscopic little hairs, and these hairs are where the nutrients pass through and get into the blood. When there's inflammation, those hairs basically get destroyed, and even the larger finger-like projections would also get destroyed during more severe cases of inflammation. So as you can imagine, the more inflammation and disrupted digestive process that is occurring, the less absorption of these nutrients you're going to get. So, So if that's occurring, you might want to get that checked out to make sure you're getting proper nutrition. In general, might make you feel a lot better overall. May take some time, but it's worth looking into. Next thing to think about here, so if you are, don't have any digestive system problems, you apparently are getting enough through your food because you're eating organic and, just have the best diet you could think of. That's great. Another thing you might want to think about is medications. So are you taking medications that could increase the demand of vitamins on your body or increase the excretion or decrease the absorption? And here's something to think about. So antidepressants, there's several here, but in general, antidepressants are going to increase the amount of neurotransmitters, which does, it's going to increase the neurotransmitter activity, which does increase the demand for certain B vitamins. And some antidepressants, like tricyclic antidepressants, increase the excretion of B12. So things like Elavil, also known as amitriptyline, definitely increase the need for B12. Diabetic medications, metformin, increases the need for vitamin B12 and folate. And acid-reducing medications, this one is a little kind of a no-brainer because you're reducing the acid in the stomach. You're going to reduce the breakdown of the food, which is going to impair the absorption of the nutrients from the food. And so it increases the demand for like B12, calcium, iron, zinc, and a few others. So these are medications like ranitidine, Zantac, and Prilosec, things like that. So let's say you're not on any medications, absorption is perfect, ideal diet. What should you be thinking about then? Well, if that is the case, that's good for you. You might also need to think about your genetics. So when we're talking about genetics here, we're talking about single nucleotide polymorphisms. So these are single point changes in your DNA. And if you're looking at the double helix right here, each one of these sections here is a nucleotide base. And when these change, it changes the blueprint of the DNA. When you change the blueprint, you change what is made. In this case, we're talking about proteins, which end up being enzymes, and those enzymes are what control our biochemistry. So you change the blueprint, you change the enzyme, which changes the function. An example here would be with, we can just use an analogy of a toy car. The toy car factory makes toy cars with 4 wheels. If we change the blueprint for the toy car factory and have it have 3 wheels, it's going to pump out a bunch of cars with 3 wheels, which those cars are not going to work as good as the ones with 4 wheels. They'll probably still roll to a small extent. You might have to kind of prop them up a little bit, but you can probably still get them to roll. And same thing is happening in our body when we have these single point changes in our DNA called SNPs. So why do you care about this? Well, SNPs turn out to be pretty common. Everyone has them. It's just to what degree and how much they're affecting us in particular. And when you do have them, we could use nutrition to support those SNPs, either bypass the genetic alteration altogether or use the cofactor, which happens to be vitamins, to support that SNP. So here's an example. MTHFR stands for methyl tetrahydrofolate reductase, and that enzyme, it turns inactive folate, like folic acid, into methylfolate. And methylfolate is what the body uses. If you have this genetic defect, you don't do that, and therefore basically not going to have a whole lot of methylfolate. And there's relative degrees of severity of this, so sometimes it'll be a small change, sometimes it'll be a major change. Basically, it's estimated that up to 50% of the population is affected by this. but probably to the extent that it is treatable or causing significant impact, it's probably more likely a third of the population is more severely affected to some degree. But there's a bunch of other, similar types of SNPs that can also affect the same pathway. So the pathway we're referring to is the methylation cycle. So this is the methylation cycle, and here's MTHFR. All these boxes are enzymes, and these enzymes can have alterations to them as well, similar types of SNPs, and there's many, many others. This is just kind of a condensed version of the methylation cycle. So basically, here's the outcome of the overall methylation cycle, and it's a little bit different than what I'm used to seeing. But basically, DNA and RNA support, so methylation to the DNA and RNA, which is it's going to help those to be produced when you're doing cell division. You also have creatine production and phospholipid production. So those are the major things that are methylation is responsible for. So when you don't have MTHFR working, you're not going to have those. Not sure protein synthesis, how that plays in here. This might be a different model, but very similar. MTHFR, MTR, MTRR, all these are big players in the methylation cycle. So that's the general overlay of the methylation cycle. So if you have an MTHFR defect, typically what you're going to see is fatigue. You could have some mental health issues like anxiety, depression, things like that. There could be a lot of times people don't even know they have low energy or don't know they feel they don't really know they're affected until you get it checked and start treating it, and then all of a sudden, many of the symptoms kind of go away that they were having, they thought were normal. So if you are having some of those things, especially if they run in family, you might want to consider getting that checked out. Another example is the COMT. So COMT stands for catechol-O methyltransferase, and this enzyme basically is responsible, major responsibility for breaking down excitatory neurotransmitters like adrenaline. We think of dopamine, epinephrine, norepinephrine. COMT is one of the players for this. There's many others that also do this, but this is kind of one example, a common example given at least. And when this is not working, it basically slows the enzyme down, and so you can get a buildup of some of those excitatory neurotransmitters, which can make you anxious, irritable, high blood pressure, trouble sleeping, those kinds of things. But you can give the cofactor for this, which is magnesium, and that can really help those folks out. So not to oversimplify this, but those are two common examples, but there's a lot more complexity to it, and sometimes you need a lot of support from doctor trying to figure all these different subtleties out of what's doing what. But those are two simple and common examples. So back to our story of who needs vitamins. So let's say you don't have any genetic issues, which is pretty rare, but nothing's really affecting you to what you can see, and not taking any vitamins or not taking any medications, I should say, and absorption is good, no digestive issues, and you're eating plenty of fruits and vegetables. So then what can we say about it? Then you might want to consider more thorough evaluation by a doctor that is skilled at looking at signs and symptoms of vitamin deficiencies. And so on the signs scenario, these are tests and objective findings that we can see. So just giving a few examples here, macrocytosis is the enlargement of your red blood cells, and typically you'll see this when the red blood cells are not able to divide properly, and that's typically from a B12, folate, or B6 deficiency. And you can see that on a common test called the CBC. It'll show the MCV will show elevated above 95, 97 is considered to be a little bit abnormal. This is not always going to show when you do have B12 folate deficiency. There's some other things that can kind of mask this, but if you do have it, then it does tell us that that's a problem. If you don't have it, it doesn't necessarily tell us that it's not a problem. Homocysteine, if you go back to the methylation cycle, you see homocysteine here. You need folate and B12 in order to recycle homocysteine. So if this is getting built up, it could be from deficiency of your folate, B12, and then also B6 takes homocysteine this way. So that's another common test that's done to look for those deficiencies. And again, it's not going to be the best, or it's not going to always show when something is off, but it is a pretty good marker for those. So why don't we just check in the blood, like, do you have enough B12, for instance? And the reason is you can have plenty of B12 in the serum, but it might not be getting into your blood. Same thing with folate. Same thing with pretty much all the vitamins. Some of them are a little more finicky than others, but you can do a red blood cell, white blood cell, B12, folate, magnesium level, and it gives you a better idea. There's also a functional test called a white blood cell nutrient analysis. This is where you take your white blood cells and you put them on a petri dish, and you basically put them on different nutrient depleted environments. So you might have vitamin A. There's no vitamin A in the petri dish. See how long the cells will grow, and if they don't grow very long, it means you're deficient. And you compare that to the population. They have controls, and you get an idea of how many standard deviations away from the normal am I, and gives you an idea of where you might be not able to, or don't have enough stores of vitamins inside the cell. So it's kind of a neat test. Symptom-wise, lots of variability here. Headaches, muscle spasms, allergies, insomnia, poor sleep. All these symptoms listed here could be from some vitamin deficiency or other. And so a skilled physician will be able to kind of point you in the right direction as to maybe where you're deficient based on these symptoms. So this, in combination with all the other things we talked about, these are the reasons why we would look at giving someone a certain vitamin or mineral supplement. And specifically with regard to the symptoms and signs, the tests, those are the people that we would definitely be thinking about giving them some extra vitamins, because the symptoms and signs correlate to where the deficiency is at. If you have the other things that are listed above, those are also important to note in deciding which vitamins you might want to take. So next thing is where do they work in our body and what do they do? So they work all over our body, obviously. Most of the work is done inside the cells, and what they do inside the cells is they work as cofactors. So cofactors are like little helpers for the enzymes, and enzymes, if we think back to the toy car factory, basically you start with plastic and you end with a toy car. Everything in between that creates the toy car from the plastic, we can think of those like enzymes. And there's things that help the enzymes, and those are cofactors. So cofactors work on neurotransmitters for the production and breakdown, because there's enzymes there that do that, and the cofactors help those enzymes work. Same thing with detoxification, elimination of actual toxins, but also breaking down of histamine and hormones. Those are all considered detoxification. Exercise recovery, also cofactors involved with that. Hormone production and breakdown, metabolism, breakdown of sugars, and mobilization of fat stores as well as breakdown of fat. Also, all of these need cofactors or vitamins to do that. So, so let's say maybe you decide between yourself and your doctor that you do need a certain vitamin. What's the best way to go about getting it? So for the oral, if you're going to do it orally, the pros here is it's simple. You just swallow a pill. The con is that sometimes they're not going to absorb that well. And so looking at the different options here, the capsule or liquid is going to be the best. That is, if it's not available sublingual. So in the sublingual, you're not going to have all vitamins available this way. But if it is available sublingually, that's probably the preferred method. So things like B12 is going to be better to take under the tongue because it is a little bit finicky in terms of its absorbability. There are some other ones that are notable that way too. Injectable, of course, don't have to worry too much about absorption here. Con is that you have to get it injected, so it might not feel good. Usually, most of them, it's very temporary if it does sting a little bit, but not all vitamins are available injectable. There's a broader array of vitamins available as intravenous, which is also a great method in terms of absorbability. You don't have to worry about that, but then, of course, you have to get stuck by a needle, and it does take a bit longer, up to an hour, sometimes more, sometimes a little less too. So those are kind of the pros and cons and some things to think about in terms of absorption and then or administration. And then this section here we're going to talk about delivery methods for each one. So B12, like I mentioned before, under the tongue or injectable is going to be the best. As you get older, you're not making enough of intrinsic factor, which is needed to absorb the B12. And here's 3 different types of B12. There's actually a 4th as well. But if you look, all these are cobalamin, cobalamin, cobalamin. And the methylcobalamin is mainly what our bodies use. This one's going to be a little bit better to cross the blood-brain barrier and maybe a little bit better in inflammatory conditions. Cyanocobalamin, probably, if you have the option, just don't take that one. The methylcobalamin is going to be superior. And if you do have the option to get an injection, that's probably going to work better than even taking it sublingually, just because it's not all going to get in there. It will get in there better than swallowing it, but it's still going to come out a little inferior to the injectable. B6 can be taken orally or can get an injection of this. This typically you're going to see improvement with like sleep, and it has a little bit calming effect. B12 is going to be more energizing. It's going to give some mental clarity, helps with brain fog, things like that. And B complex also can be taken orally. It can be given injectably too. For the most part, B complex is going to be B1, 2, 3, 5, and 6. Sometimes there'll be folic acid in there as well, which not a big fan of because of the genetic issues. If you can get a B complex with methylfolate, it's probably going to be better unless you're sensitive to it. But we're not going to get into all those details here. But B complex, you can get an injectable or oral. It's fine, and yeah, it works good for lots of different things because there's so many vitamins in the B complex. It's a good general support. So, if it does seem like you're not absorbing or deficient, B complex might be helpful there. Notable with all the B vitamins is that, if you are having a reaction to them, it could be because of what the microbes are doing to it after it's swallowed. Microbes do like to consume B vitamins, so if you're having a reaction, it could be because not from the vitamin itself, but what the microbes are doing to it. MIC is methionine, inositol, and choline. This is used to help with detoxification, so it helps make bile acids. and because of that, also can be useful in weight loss. This can be given injectably, or I guess it's probably available orally as well, though I don't use it that way typically. B5 is a great vitamin, helps with the adrenal glands, so stress and things like that can be given injectably or can be taken orally, and there's not a lot of absorption issues with B5. So it can help support your energy a little bit. If you're really stressed, it's probably a good idea to take a little bit of B5 for that. It also supports histamine breakdown, and it's overall just pretty good vitamin to consume if you have those issues. So a few others here: magnesium, as I mentioned earlier, soil's depleted in magnesium, so a lot of people are deficient in magnesium. Different forms of magnesium in terms of what it's chelated to, and that will change how the magnesium works. But in general, it's going to be taken orally. You can give it injectably, but most of the time it's given orally, and it's going to have more of a calming effect both to the mind and the muscles, so it has a muscle relaxing effect. And vitamin D is actually a hormone, but it is in the vitamin category. This is going to help with bones. It's also going to help with the immune function, helps balance out hormones in general. Has a lot of broad-based functions, some roles for blood pressure, weight loss. And vitamin D is pretty common for folks to be deficient in, but you can take too much of this one, so be careful. It is fat soluble. You can get into some trouble if you take too much vitamin D. And it is available injectable, but that injectable form, you need to be looking at labs and things like that and be monitored. Methylfolate, this is the treatment for MTHFR. This one should be avoided unless you know you have a genetic defect, and even then use with caution. It can make things worse. You have to kind of usually going to be best to have some sort of feedback by a physician that treats genetic alterations like the SNPs mentioned above. But it is fairly safe and it has a short half-life, so injectables used for those folks that don't absorb it well, and then usually is going to be best taken orally unless, again, you're someone that's not absorbing it. There's a couple of homeopathic injections and that are useful for cold and flu prevention and improving how your immune system works. And one that we use is Engystol, Engystol, I think. So that works really good for especially people that are chronically sick and have allergies. So here's some common questions. Can I just take vitamins by mouth? We've covered that pretty well here, I think. This is because of absorption issues, because of digestive issues, and then there are some genetic reasons why you might not absorb stuff well too. So keep that in mind. How often should you get an injection? Well, if you are getting injection and you're getting benefit from it, I would say use your judgment based on how much benefit you're getting and is it wearing off. If you need it every week, maybe you do need to be built up until your body can restore its ability to absorb again, or once the stores get built up throughout your body, you may not need it as much. But I would say anywhere from once a week to a couple times a year is basically what most people are going to do in terms of injections. But it's really going to be kind of a unique, individualized thing. Side effects from taking vitamins orally injectable, definitely. Common problem is taking too many vitamins just as much as not taking enough. So know what you're doing, ask questions if you're unsure, and seek out advice when you're stuck. But vitamins, just like water, if you take too much, you definitely get some problems. As far as intravenous or injectable is pretty much anybody can get injectable of the vitamins that are available that way. Intravenous, there's a few screening things that have to be done. Kidney function. There's some genetic reasons why you might not want to take high doses of vitamin C intravenous, but it's a pretty safe thing overall. So, if that doesn't sound like you, you're probably a candidate, but you'll still need to have at least a short evaluation by a doctor before you start taking vitamins intravenously. So that pretty much covers the basis of what I wanted to go over and share with you today. So we did talk about why you need vitamins to begin with, soil depletion, poor absorption, all those things create the picture of your health and whether or not you need them. It's a decision that either you need to evaluate yourself or evaluate with your doctor, which is the preferred method, but not always necessary, but sometimes can be really, really useful. They'll be able to point you in the right direction of, like, how do you know you actually need this? That's because of the, education on, what the vitamins do and how they're going to affect your body. Not all doctors are, trained in these kinds of things. So if you're not finding the information from your doctor, you might want to seek out a physician that seems to have a little more understanding of these things. So that would be like a naturopathic physician or functional medicine doctor, of which, we at my clinic, we're kind of, both of those things. They are somewhat synonymous, but not all functional medicine doctors are naturopathic physicians, and not all naturopathic physicians practice the functional integrative ways. But there's quite a bit of overlap for both. Lastly, we talked about what the options are. So hopefully this was useful. I'm happy you attended to this point, and hopefully you found it useful. If you do have questions about some of the content here, you can feel free to reach out to us through the contact form on our website or the Facebook page if you're part of that. The contact form is on discoverholistichealth.org, and just click on the contact section, and there's a little form you can fill out, and it'll go directly to our email so we can respond to you. And that's it. Thank you.